Hello, this is Kimberly with Unity Environmental University. I'm here today to speak about canine hip dysplasia. Hip dysplasia is a common inherited skeletal condition which occurs due to abnormal development of the hip joint. The hip joint is also known as the coxofemoral joint, characterized by joint laxity or a loose joint, a subsequent degenerative joint disease referred to as osteoarthritis. Osteo meaning bone, itis meaning inflammation. Heredity factors, nutrition, excessive growth, and exercise affect the occurrence of hip dysplasia. More commonly, it is found in the larger breeds. They are more at risk, but small breeds have been known to also develop hip dysplasia. This is a picture of showing the femoral head going into the acetabellum, which is the socket. It is referred to as a ball and socket joint. And when it is not staying in place or stabilized due to loosening or laxity, that is when hip dysplasia and osteoarthritis are prevalent. Lameness can be mild, moderate, or severe. Any of those should be checked out by a veterinarian immediately. Bunny hop gait, that is when the legs in the hind area during locomotion stay stiffened and it looks like they are hopping from behind. It looks cute, but it definitely means something is not working correctly. Pain when extending or flexing, opening or closing the legs, commonly observed when the dog is trying to stand up from a lay down position. You might find that the dog has pain every time it goes to stand up from laying down, and that is a concern. Inflammation of the hip joint also causes pain and can also cause a grinding noise. Diagnostic testing used to determine whether or not your dog has hip dysplasia or osteoarthritis. Radiographs or x-rays are used while the dog is under anesthesia so the muscles stay relaxed. The dog is placed dorsally, which means on their back, with the hind limbs extended caudally. The femurs are straight, the pelvis is straight, and there is internal rotation of the femurs. The thoracic or upper limbs must be kept in place so they were stretched with utilizing the proper devices to keep that in place as well to get the proper pictures. Treatment, there is non-surgical and surgical. Non-steroidal anti-inflammatory drugs, physical therapy, joint supplements, and injections are sometimes options. The joint supplements are given sometimes before a dog even shows signs, just to give them a better chance at not developing. Surgical options, total hip replacement, femoral head and neck ostectomy, also known as the FHNO. Um, Immature dogs, um, they will do with the triple pelvic osteomy, the TPO it's called, and that is to change the position of the acetabellum or the socket to improve the biomechanics of the hip joint to give them better uh, rotation and movement without pain. Precautions to take. It is important to keep your dog at a healthy weight. It is important for annual vet care. Test breeds at risk and predispose puppies at an early age um, to see if they are showing signs. Maintain proper daily exercise, which means don't overdo exercise as well. A lot of working dogs are over exercised and they end up um, with osteoarthritis. And know the signs, know the symptoms. If you see any of the symptoms, immediately contact your vet and have them tested properly and follow the vet's directions. Thank you for watching my presentation.